relationships, work, and social confidence. Scoliosis doesn't just affect your back. It can also affect your relationships, your job, and how confident you feel around other people. It's common to feel self-conscious or unsure about how to talk about your condition. You may even feel like you have to hide it. But the truth is, you don't need to be ashamed of your scoliosis. Your body tells a story of strength, and it's something you can talk about with confidence. This chapter will help you feel more comfortable discussing scoliosis with others, handle dating and close relationships when you feel vulnerable, and make smart choices about your career based on your body's needs. Talking about scoliosis without shame. It's easy to feel like you need to keep your scoliosis a secret. You might worry about what people will think or how they'll react if you mention it. But hiding your condition can lead to stress, isolation, and low self-esteem. Being open about scoliosis doesn't mean you have to tell everyone everything. It just means being honest when it matters and talking about your experience in a way that shows you're strong, not broken. Here are a few tips for talking about scoliosis with confidence. Keep it simple. You don't have to give a long explanation. Try something like, "I have scoliosis, which means my spine curves a bit. I've learned how to take care of it." Use a positive tone. Focus on what you've learned or how you manage it. This helps people see your strength and not just the condition. Answer questions when you feel ready. Some people may be curious. You don't have to share more than you're comfortable with, but it's okay to educate others too. Talking about scoliosis without shame shows others and yourself that your condition doesn't define who you are. It's just one part of your story. When you feel vulnerable. Dating can be nerve-wracking for anyone, but when you live with scoliosis, it may bring extra worries, like how your body looks, whether your curve is noticeable, or if a partner will understand your limits or pain. It's normal to feel vulnerable, but it's also important to remember your value is not based on your spine. You are lovable and worthy of close, caring relationships just as you are. Here are some ways to feel more confident in dating and intimacy. Be honest at your own pace. You don't have to bring up scoliosis right away, but sharing when you feel comfortable can build trust. Choose someone who respects your boundaries. The right partner will care about you, not just your appearance. If someone doesn't show understanding or kindness, they aren't right for you. Focus on connection, not perfection. Intimacy isn't about having a perfect body. It's about closeness, trust, and being real with someone who makes you feel safe. You deserve relationships where you feel accepted, respected, and free to be yourself, curve and all. Navigating career choices with body limitations in mind. Scoliosis may affect how you sit, stand, lift, or move at work. Some jobs may be harder on your body than others. That doesn't mean you can't have a fulfilling career. It just means you may need to think carefully about your needs and plan ahead. Here's how to choose or adjust a career with your body in mind. Know your limits. Pay attention to how your body reacts to sitting for long hours, standing all day, or doing physical labor. Choose jobs that don't push your body past its safe limits. Look for flexibility. Jobs that allow you to move around, take breaks, or adjust your workstation can help prevent pain and fatigue. Ask for accommodations. Many workplaces will provide tools like standing desks, ergonomic chairs, or lighter duties if you explain your needs. Focus on your strengths. You bring more to a job than just physical ability. Skills like communication, problem solving, or leadership are just as valuable. You might also consider remote work, creative careers, teaching, counseling, customer service, or other roles that let you work in comfortable positions while still making a difference. Remember, having scoliosis doesn't stop you from building a career you're proud of. It just means being smart, honest, and creative about how you get there. Final thoughts. Scoliosis can make some parts of life feel harder, but it doesn't take away your ability to build strong relationships, feel confident in your own skin, and succeed in work that matters to you. When you speak with honesty, lead with strength, and make choices that protect your body, you'll discover that you are capable of more than you thought. You are more than your posture, more than your X-ray. You are a full, valuable person with the power to live, love, and lead in your own unique way. Becoming your own health advocate. Living with scoliosis as an adult can be frustrating, especially when it feels like some doctors don't really understand what you're going through. Maybe they've told you it's just back pain, or nothing can be done. But you know your body best. You know when something isn't right. That's why one of the most important steps in managing scoliosis is learning how to become your own health advocate. Being a health advocate means speaking up for yourself, asking questions, and finding the care that fits your needs, not settling for answers that don't help. This chapter will guide you through how to talk to doctors, find the right specialists, and stay informed about new scoliosis research so you can take charge of your health with confidence. How to talk to doctors who don't understand scoliosis. Unfortunately, many general doctors don't have in-depth training in scoliosis, especially when it comes to adult patients. You might run into providers who think scoliosis is only a concern for teens, or who only recommend surgery as the solution. This can leave you feeling ignored or discouraged, but don't give up. Instead, learn how to speak up for what you need. Here are some tips for getting better results when talking to doctors. Be clear about your symptoms. Instead of just saying, "My back hurts," explain when it hurts, what makes it better or worse, and how it affects your daily life. Bring notes or records. Write down questions before your appointment. If you've had X-rays, MRIs, or genetic testing, bring those with you to help explain your history. Ask specific questions. For example, are you familiar with adult scoliosis management? Can we talk about non-surgical options like physical therapy or functional medicine? Be honest but polite. If a doctor dismisses your concerns, you can say, "I'd like to explore other approaches because this has been affecting my quality of life for a long time." Don't be afraid to get a second opinion. If one doctor doesn't understand scoliosis or isn't willing to listen, it's okay to find someone else. You deserve a care team that takes your condition seriously. Finding the right specialists and therapies. One of the best things you can do is connect with a scoliosis specialist, someone who does understand your condition and offers treatments beyond the usual watch and wait advice. Look for professionals who offer scoliosis-specific physical therapy, not just regular back exercises. Reflexive movement therapy, such as the ScoliSmart activity suit. Functional medicine approaches, including hormone, neurotransmitter, and genetic testing. Custom bracing or support gear designed for adult scoliosis. Alternative therapies like chiropractic care, massage, or acupuncture when used as part of a full plan. When you talk to a new provider, ask them, "What experience do you have treating adults with scoliosis? What kinds of results have your patients seen? Do you offer a long-term plan, not just short-term relief?" It may take time to find the right team, but once you do, your care will feel much more personal, focused, and hopeful. Staying educated and empowered through new research. Scoliosis care is changing fast. New studies are showing how genetics, hormones, and brain-body connections all play a role in how scoliosis develops, and how it can be treated. The more you learn, the more confident you'll feel about your choices. Here are some simple ways to stay informed. Read articles from trusted sources. Look for scoliosis research journals, scoliosis-focused websites, or organizations like the National Scoliosis Foundation. Follow scoliosis experts online. Some doctors and therapists share updates on Instagram, Facebook, or YouTube. These short videos can help explain new treatment ideas in easy ways. Ask your care team for reading materials. A good specialist will be happy to guide you to trustworthy information. Join scoliosis support groups. Other adults like you often share great tips, helpful research, and real-life experiences that can encourage you to keep going. The more you understand your condition, the more power you have to ask for the care you deserve. Final thoughts. Becoming your own health advocate might feel hard at first, but it gets easier with practice. You don't need to have all the answers. You just need to keep asking questions, trusting your instincts, and refusing to give up. Scoliosis may be a lifelong condition, but that doesn't mean your care should stop. You deserve doctors who listen, treatments that work, and a plan that fits your life. With the right tools and the right mindset, you can take charge of your health and feel proud of the progress you make. You are not just a patient, you are the most important member of your care team. You are more than your posture, more than your x-ray. You are a full, valuable person with the power to live, love, and lead in your own unique way.